Good afternoon, Berkeley, and thank you for joining us for this virtual town hall with our City Manager, D. Williams-Ridley, and our City of Berkeley Health Officer, Dr. Lisa Hernandez. And I want to thank our City Manager and Public Health Officer for joining us today, as you have over the past several weeks. I know the Berkeley community really appreciates you making yourself available, not only to answer questions, but update us on the city's response to COVID-19. And we received a number of questions, which we will get to this afternoon. And if we're not able to get to your questions, we'll be sure to get to them next week. But to open our town hall today, I want to once again talk about what's next. And we know that Governor Newsom on Monday announced that the state was going to be easing restrictions on certain businesses, bookstores, florists, and a number of other businesses in the city of Berkeley and in the San Francisco Bay Area region. We are not yet ready to ease some of those restrictions on certain businesses that are not essential. And that is because we are continuing to monitor the data on infections and hospitalizations and make sure that we're making decisions that are based on the data and based on balancing economic recovery with preserving the health and safety of our community. And I want to take this opportunity to thank our public health officer, who's really been a leader in these regional discussions and helping shape the orders that public health officers throughout the region have adopted. And I think we can all agree that they have had a tangible impact in flattening the curve. And our health officer will talk a little bit about the number of cases as of today, but the infection rate has generally been under 5% of those total cases, those tests and cases. And I think that's an indication that sheltering in place, although it has been challenging, not just for our residents, but also for our businesses, is essential to reducing the spread of this deadly virus and to keeping you and your family and the community safe. It is having an impact. Wearing a face covering outside is having an impact. Physical distancing is having an impact. So I want the Berkeley community to know that we are discussing not just internally within the city organization, but I know our health officer is discussing with regional health officers how to plan a transition out of this shelter-in-place order and to start easing some of the restrictions on certain types of businesses. And we are not going to rush into that, but make decisions that are thoughtful, that are based on the data, and also working to ensure that we can consider the needs of our business community and start opening up some of those sectors that have not been able to fully operate during the shelter-in-place order. And so to that end, the regional health officers, which include a number of counties and the city of Berkeley, which is its own public health department, have developed 6 indicators to guide I think there are 5 indicators, apologies, to guide the decision about how to ease some of those restrictions and make the transition. And I just want to touch upon some of those indicators. The first indicator is looking at the total number of cases in the community and seeing whether those cases are flat or decreasing, and the number of hospitalized patients with COVID-19 and whether those numbers of hospitalized patients is flat or decreasing. Making sure that we have sufficient hospital capacity to meet the needs of our residents. Making sure that we have sufficient COVID-19 viral detection tests that are being conducted each day. Making sure that we have sufficient case investigation, contact tracing, and isolation and quarantine capacity. And lastly, making sure that we have at least a 30-day supply of personal protective equipment for all healthcare providers. And these indicators are really making sure that our hospitals and medical facilities have the capacity to deal with the surge in cases, making sure that we have adequate testing to be able to understand the level of spread in our community and treat people that have contracted COVID-19. And also making sure we have the contact tracing, case investigation capacity to understand the level of spread in our community. So all these things are things that we are working on in the city of Berkeley, and I'm sure our health officer will elaborate during her remarks and in answers to questions. But we are going to be making decisions based on these 5 indicators, as well as looking at the guidance from the state of California. And I am going to be working with our city manager and city organization to develop a plan for that short-term transition to start easing some of the restrictions and bringing those businesses back in operation with safety measures, because we are not going to be able to go back to the way it was before. We are going to have to practice physical distancing, facial coverings, maybe something that we will have to continue to wear for the time being. and making sure that our businesses are implementing practices that are keeping their employees safe and residents safe. So please know that we are discussing all these issues, and we will be working in the coming days and weeks to develop a plan, which we hope to announce soon, working in partnership not just with the state of California, but also the regional health officers, our business community, and other stakeholders. So with that, I want to turn it over to our City of Berkeley Public Health Officer, Dr. Lisa Hernandez. And Dr. Hernandez, if you can give us an update on the number of cases in Berkeley as of today, and any other information you'd like to share with the Berkeley community, we would greatly appreciate it.
Sure, I will. Definitely want to start with the state of California first, just to give you a little bit larger context, drill down to Alameda County and then City of Berkeley. For state of California, we're at 63,512 cases with 2,582 deaths in the state. For the county of Alameda County, that's not including our numbers, it's 1,897 cases with 69 deaths. City of Berkeley, we have 66 cases right now and 1 death. I want to talk a little bit about tests. I'm going to try to weave into my presentation some of those indicators and where we are with some of those indicators, and then talk again about the indicators when I talk about the health officer orders. And I want to thank you, Mayor Arreguín, for talking about the indicators, because those are really what's guiding us, not only in public health, but as you mentioned, in the city, in terms of making our decisions and hoping that we can move forward with our restrictions. So in terms of total tested for people here in the City of Berkeley, residents, are 1,418 tests have been performed and reported to us here in public health. The percent positive is what you were saying, Mr. Mayor, is below 5%, and it's 4.6% right now. In terms of average number of tests per day, for the last 7 days, it's been about 39 tests per day. We need to reach 240 tests per day. So we definitely have a ways to go, but we're getting better. There were some comments I saw in some of the questions about, are we getting better? Are we seeing more tests being available? And the answer is yes. So I want to talk a little bit about our expanded capacity here with our test site. So the test site that we stood up several weeks ago has been incrementally expanding our capacity and our focus. Right now, we're able to test anyone who lives and works in the City of Berkeley who is symptomatic. And we've gotten a great response from the community calling into our nurse screening line. We have that staffed by nurses who will answer questions about the testing. And if you're symptomatic, we can help you get scheduled into an appointment. We are not the only game in town. There are other, our providers are also expanding their testing capacity as well. So that is excellent news. Back to our screening line, I want to have that number for you. I know the mayor presented that number last week, but I just want to remind everyone what it is. It's 510-981-5380, and it's available Monday through Friday from about 9 to 4 p.m. It's bilingual, so there's someone that can speak Spanish there if you're a Spanish speaker, and we'll get you scheduled for an appointment. Sometimes same day, sometimes it'll take a day or two. Also want to talk about a vulnerable population. That is our task force that we have focused on a certain population that we're more worried about. And that includes those that are in skilled nursing facilities. As we heard, a number of the deaths, a good portion of the deaths that are seen nationwide are occurring in skilled nursing facilities. We are focusing on that community as well. We did a pilot test earlier in the week with one of our skilled nursing facilities to test all residents and staff that are present at that facility for COVID-19, whether they were symptomatic or not. And that was a good process. It was a great partnership with our medical community, and we're going to move to other facilities to do the same thing in a couple of weeks after we refine a process. Good news, everyone was at that time negative. So that means no COVID-19 in that community. We're also working with other facilities such as apartment complexes that have a number of seniors in them. We're giving outreach and hand washing and hand sanitizers and instructions and information, as well as face coverings for those communities. So we're starting to do more outreach in those communities. Want to talk about another thing that people are wondering about as it's part of our indicators, which is our case interviewers and our contact tracers. Maybe we'll call them the Berkeley tracers, but they're the individuals that are helping us make sure that we have everyone that's been exposed to the disease be aware and then being able to isolate. So we're expanding our capacity. We're tapping into our city staff, expanding that group. We're training them, and we're looking in to volunteers and other opportunities. So I want to let you know we're working on that so that we can meet some of those indicators that we are using to track our progress and our ability to relax some of our shelter in place restriction. So let's talk about that. As the mayor mentioned, we have our shelter in place order. The most recent order was it became effective on the 4th of this month. So that was just what's today, 5 days ago. So we are have already eased some of our restrictions. The governor has ease some of the statewide restrictions, but as the governor mentioned when he released his new resilience roadmap, he mentioned that this is not a one size fits all type of order, that it will the restrictions may be different based on the geography. So and he specifically mentioned the Bay Area, where we are in a different situation than other parts of the community or of the state. So we are still stricter, and those restrictions have to be abided by. We're hoping to move into the next phase here in the city of Berkeley, but we're not there yet. I do want to thank everyone for adhering to our shelter in place orders. I know it's tough, but it's something that we must do to make sure that we keep our community safe. So I want to again talk a little bit about those indicators so everyone is aware how we're tracking them. As the mayor said, the number of cases that we have and the number of hospitalized patients are flat or are decreasing. We're going to see a bump in the number of cases because we are increasing our testing, and that's expected. What we're also looking at, especially immediately, is the number of hospitalizations, because those that are hospitalized are being tested and treated. So we know we're watching that number to see how we're doing. We're having a little bump in the hospitalizations, but not by much, but we know that that's going to be our best indicator. And we'll also be looking at Alameda County data for that because our numbers are small, but our cases, that's something we can track. In terms of hospital capacity, as the mayor mentioned, it's looking at the bed capacity and knowing that we have enough beds or places in our hospital for both COVID-19 related hospitalizations as well as non-COVID related hospitalizations, because we want to make sure that there's enough capacity to make sure that our community is being able to be served in the hospital. And I want to make sure people know that if they're sick, they should go see their provider. They should go to the hospital. They should not wait. Calling first is best, but if you can't, you need to go see your provider and go to the hospital if you feel that you must. Third is the sufficient testing capacity. Right now we're using the PCR test. That's the swabbing, nasal swabbing test. It's not the antibody serology test. That's not going to be used right now for diagnosis of COVID-19. We are tracking when we get reports of the antibody test, but that's not the number that you see when we're reporting those numbers. And the third is sufficient workforce. I just mentioned about our workforce for case investigation and contact tracing and isolation and quarantine. We're tracking those numbers, and we're hoping to get get a capacity to meet the needs that we're anticipating in terms of new numbers of cases. And we're doing well now, but we know it's going to change because we're going to get more cases. And then again, the supply of the personal protective equipment for all our healthcare workers. We are on track. We are on track to with all those indicators, and we're hoping that we can move into the next phase of the shelter in place. As was mentioned, we're talking, the health officers as well as city leadership are talking often about these measures and how we're going to move to the next phase as soon as we can, balancing safety as well as the community need. I want to end by wishing everyone a happy Mother's Day. Tomorrow's Mother's Day. So I will hope that people, including Madam City Manager, has a good Mother's Day. And I want to make sure that we celebrate appropriately. That means if your mom doesn't live with you, don't go visit her. You can drop her a note. You can mail her a card if you haven't done it. I'm not sure if it's going to get there by tomorrow, but you can call her, FaceTime. I'm going to do that with my mom tomorrow. And the nice thing is that my kids are here. They can talk with their grandma. Normally they're out, they're home. So all of us are going to have a better Mother's Day because of that. So I just wanted to wish everyone a good day. And again, thank you for everyone's efforts to keep our community safe.
Thank you, Dr. Hernandez, and thank you for reminding us about Mother's Day and ways that you can safely thank and honor your mother. I want to recognize and honor both of you, and I want to acknowledge my mother, who I think is watching this broadcast, to say, I love you, Mom, and thank you so much, and happy Mother's Day. And I actually ordered flowers, so there are ways that you can, celebrate and honor your family without actually going to see them in person. So please honor Mother's Day safely. And with that, I want to go to our city manager, Dee Williams-Ridley. And Madam City Manager, could you give us an update on city operations and any other information you'd like to share with the Berkeley community?
Yes, thank you, Mr. Mayor. And again, thank you so much for putting these together, and including Dr. Hernandez and me. We actually enjoy these. Now, I know Mother's Day is around the corner, but this is something that I think is really important for the community and for our staff to see the collaborative and collective effort in terms of making sure our community is informed. So I do want to cover a few things. Number one, our staff are fully operational in terms of working in the EOC. So we're still very committed in the EOC. Of the up to 1,600 employees that we have in the city, we probably have about anywhere from 1,400 of those employees deployed in some manner. So for example, we have a number of them working in the EOC, working from home, or being deployed out in the community. And we're still maintaining essential city services, our police force, our public health, mental health, as well as our public works department. So we're still churning and working. So you'll see people out there working from waste management to parks. And I just want to thank them for still being out there on the front lines. One thing I do want to mention is that for our police department, if you see an officer out there and you need a mask, reach out to them. We've equipped them with mask facial coverings so that if folks need them in the community, you can access one. We do encourage folks to continue wearing facial coverings and being very responsible for each other and for yourself. In terms of the EOC and some of the work that's happening there, I do want to just highlight a couple of things. So with the new orders, it can be really confusing for people that are sheltering in place, especially our merchants. And I want to make sure that folks are accessing our website. We've created a website specifically for merchants seeking business guidance. There's fillable compliance checklists around determining what folks need for distancing protocols. We've prepared facial covering requirements in both English and Spanish. And there's downloadable signage on COVID-19 precautions that I think is really important. And then there's additional recommendations from industries such as grocery stores, restaurants, and food delivery and essential retail. So please visit our website to look at that information. It's very helpful. One of the things that I think is also important to share with the community are some other resources. Now, with all of Berkeley and the Bay Area region have not yet met the local indicators for relaxing the shelter-in-place orders, businesses can review the state's guidelines as a resource so they can start thinking about eventually reopening. They can look at things, there are examples of plans for how to train their employees, disinfecting protocols and distancing requirements. Those things will help, Mr. Mayor, as you spoke earlier about creating a Berkeley specific plan to move us forward. And so there's a roadmap. It's called the California Recovery Roadmap Survey. So people should try and access that information so that they can get prepared with us. And we're going to be reaching out, as the mayor stated, to multiple stakeholders to get folks engaged so that we can make sure that our city's ready to move forward. And lastly, also on our website, you'll see information about CDC resources, cleaning and disinfecting public spaces and workplaces, businesses, schools, and homes. So we have multiple stakeholders out there that are ready and mobilizing to get themselves ready as soon as our health officer and others say it's safe to do so, along with the governor's indicators. Again, I just want to thank everyone for their time, for their commitment to keeping our community safe. I know it's hard, and I believe we are doing a fabulous job. So please hang in there and stay tuned, because we'll be working on a Berkeley specific plan forward. Thank you, Mr. Mayor, and I'll turn it back over. I know folks are ready to get to some of the questions.
Thank you, Madam City Manager. So with that, we'll go to questions. And first set of questions I'm going to direct to the City Manager as they relate to city operations and other related issues, including enforcement. So the first question that we have received from a local resident is, does the city have a plan to help businesses that will be reopening eventually with acquiring PPE for their staff? And this person acknowledged that it is very challenging for residents and businesses, as well as local governments, I would add, to acquire PPE. And so this gets to something that we have already talked about, but I guess that's one specific aspect is how are we going to assist or make available PPE to businesses? Right now we're focused on PPE for our city staff, our essential workers, as well as for residents who don't have face coverings, for example. But I don't know if there's anything you want to share on that point, Madam City Manager.
So I'd just like to say, I know that the availability of many PPE items and sanitizing supplies, it's increasing. And so as the shelter in place restrictions are relaxed, we're going to stay engaged with businesses to assess and support and try to help and meet those needs. At this time, as you stated, Mayor, we are using what has been procured for first responders and for staff in the field responding to COVID-19 response plans. But we do want to make sure that our businesses are equipped and ready. So our goal would be to figure out how we can support them best. And again, the availability of these items, it is increasing. So we do anticipate that we can be supportive in some way. If it's not to provide them with where to acquire, the best way to acquire PPEs and or provide them with actual PPEs. So we'll be looking into this as we move forward in our easing of the restrictions.
Thank you very much. This next question, very direct around one particular business. Can you allow Games of Berkeley, which is a wonderful business that provides board games and other types of games in Berkeley? It's on Durant Avenue. Can you allow Games of Berkeley to provide curbside pickup so I can get puzzles to keep my sanity?
That's real. That's real and serious.
Yes. I don't know about where this particular business falls in the various classifications of essential businesses. But this is something we could take back and look further into unless you have any further information that you could share at this time.
So I don't have any further information other than to say at this time, it is not one of our essential businesses that's available to have access to roadside curbside service. We hope that very soon and quickly, small businesses like that can reopen soon. But that's going to take, again, some of the indicators that you talked about earlier. In the meantime, we'll go back to check and make sure. I'm always going to double check with our health officer, with our team, city attorney, if we feel that there's something that we can do differently based on advice from our surrounding jurisdictions, as well as our health officers. So we do take a number of things on a case-by-case basis to look at them, to see if there's changing needs or something we've missed that should be allowed. And so we're flexible in that way, but we're also strict in the other way. So
thank you. So the next question is around, how is the city administration spending its staff resources right now?
Right.
And there were some very specific questions around categories of jobs and workload, but I think that's a really good question, an opportunity to kind of give the Berkeley community an update on how we've really kind of pivoted very quickly, our whole city organization, to respond to this.
Yes. So back in January, and in January, we activated our EOC immediately. We didn't wait until declaring an emergency. I activated the EOC immediately once we started receiving information and details about the virus. So we set ourselves up to slowly bring forth a plan of action that set our EOC up in multiple functional areas. So we have about 7 functional areas within our EOC that focus on a huge amount of work. So that's a body of people, I would say about maybe 60 to 75 people. Then you have and I'll go into a little bit of detail about those. So you have a group of folks that are working on financial recovery. How do we recover funding from state, federal, FEMA, whatever the recovery is? We have a group of folks that are particularly dedicated to that effort. We also have a team of folks that are working on our unhoused community in terms of finding locations to streamline and or to decompress our existing shelters and find locations for those that are unhoused on the street. So we have an unhoused team. Then we have a team that's specific to communications. That team comes in and they're formulating messaging, gathering information, sorting through all the mounds of data and information that's being shared from so many entities: CDC, World Health, the state, the city, the counties, and creating structure so that people can get information easily. And they're posting that information on our website and disseminating, tweeting, answering emails. So we have a team assigned for communications. We have another team that's assigned to public safety and logistics. So, and I'll call it logistics because when we need a site for a shelter, that team is going through the city, looking for which site is the best shelter, organizing the folks that are going to lift that shelter up. The same thing with locating where we could locate and place our RVs. So we have a logistics team. We also have a health team. There's a public health team, mental health team. That team is set up to deploy and to work on how we get folks out into the community to do direct outreach. And then, of course, you have all of your essential services. Public Works is still working on our streets. They're still working on installing equipment in the downtown area, power washing, working on sewers. All of those services are still essential. We still have parks folks that are out in our parks, cleaning them up, cleaning restrooms, making sure that parks are used in the way that they should be used, and those that are restricted are restricted. For example, our skate parks are open. We have monitors at the skate parks to make sure that people are complying with the health officer's regulations. We're also building a team of folks to do contact tracing. And I'll jump to that because I know that is a question, Mayor, that I believe you'll, that there's a citizen asking, and others have asked too, about contact tracing and how people can volunteer. So we have a group of contact tracers, and there are two categories of tracing. There's investigators, and then there's also, I believe, the folks that review the information and analyze the information and make calls. So with two sets of tracers, we are working both with UC Berkeley public health students, as well as the library staff here in the city, as well as other public health staff, and we have a contact tracing team. If we need volunteers, we're going to try and set something up to receive volunteer efforts in, but right now we believe we have the staffing for our contact tracers, and we're going to be training them over the next series of days. So, but we are we're open, and we're trying to find an avenue and working on an avenue to allow for volunteers to support and work with us. So, and then you have administration. So a number of the big pieces that are still being handled in our city is preparing our budget, making sure that we're paying employees on time, making sure that we're paying our bills, making sure that we're managing our debt portfolio, and paying everything that we need to make sure that we're able to commit, that we've committed to as a city, that we're able to handle those obligations. So, so staff in-house, we still have people that are working in city buildings, but they are closed at this time, but they are very, very sparse. Not a lot of people are sitting in desks and chairs. We have them working from home. We're also working still with our labor groups. We have all of our bargaining groups are open for contract negotiations at this time. So we have a lot of work to do that's still happening. We're still running a business, a municipality with multiple disciplines. So and we're doing a good job. We're very focused right now, and we're delivering for the needs of Berkeley. So I didn't mean to go on and on, but thank you for the opportunity to just really tout, just really talk about some of the amazing work that still has to happen, and the work that's dedicated specifically to COVID-19. And our staff is doing an amazing job. So I appreciate that.
Thank you. I agree, our staff is doing an amazing job, and I really appreciate you kind of breaking down all that we're doing within the city organization to respond to this. And it happened very quickly.
Yes.
You're right that we did activate the EOC in January, but as the number of cases started increasing, we've had to really redeploy our staff very quickly. And I think it just really shows not just the incredible people we have working for the city organization, but how we need to be flexible in how we respond to these types of emergencies, which I do think increases our capacity to respond to other emergencies in the future, whether it be fires or earthquakes or other natural disasters. The next set of questions are around enforcement of the mask order. And I know I've gotten a lot of questions, not just by email, but also just seeing people on the street from an appropriate distance around the mask order. I know some people that are vulnerable to the COVID-19 are concerned about walking on the sidewalk because people are running or biking and not wearing a face covering. Some people are concerned about just people going to the grocery store not wearing a face covering. It's like we had several questions around what is the city doing to educate and enforce our residents around the requirement that they have to wear a face covering. And Madam City Manager, if you can touch a little bit upon sort of the outreach efforts. We're not arresting people for not wearing a face covering, but we do need to ensure that people understand how serious this is for their health and safety.
Yes, so early on, we started documenting what type of complaints, and we do this on a weekly basis, what types of complaints. Where we're seeing the majority of complaints now, it went from construction, which is still up there in terms of seeing people working at sites without observing different protocols. And And we're now seeing more about parks and neighborhood gatherings and people on the streets. So one of the things that we've talked about doing here recently is deploying monitors across the city that can not only provide information about what's required, and I want the health officer and I to really speak to that about what's required and what's recommended, because there are two different things that's happening that I think is a little bit adding to the confusion for folks. So number one, we're looking at deploying monitors across the city to provide information as well as to hand out facial coverings. And we're mobilizing that team as we speak. We've been working on that as an effort. I wanted it to be a last ditch effort because we wanted to deploy people in other areas to make sure we were addressing COVID-19 response. But not only we've already deployed monitors for our construction sites. So that's already happened because that's the first ease back in. So we wanted to make sure that they were aware that not only are you going to have to fully comply, but we're going to be checking physically and calling and walking up and making sure that those rules are being met. But we also want to deploy them throughout the city in hotspot areas where we're hearing the most about non-compliance. So let's talk a little bit about recommended versus required. You are required to wear a mask when you're standing in line for an essential service or to obtain to procure something from a business. You're required to wear a mask when you're inside of a business. You're in a grocery store. You are in some closed facility where others are. You're required. When you're out walking about or you are in the park, you are not required. It is recommended that you wear a mask, especially if you're going to come into contact with others within 6 feet. So the idea is that we recommend it and that you have it on your person. So and the visibility of this shows people that I'm ready to respond if I get too close to you, and it makes people more comfortable. So we want to encourage all of our citizens to wear and or carry with them at all times a facial covering, because it just helps people feel good about their community. It makes you have a sense of safety, and you know that as you're passing someone, they're recognizing that this is an important thing that we all need to observe. So there's a recommended and a required. And Dr. Hernandez, I don't know if you want to add to that in any way.
I think you covered it beautifully. I will just give a personal example. Last night I was walking outdoors with my husband, and I had my face covering with me, and I also saw my neighbors walking, and I felt better when exactly the point that you made about if you're not wearing the face covering when you're outside, visibly showing it makes people feel comfortable. I felt reassured with that when I saw my neighbors wearing them, and I felt like they cared about me, they cared about themselves, and I think this is the new cultural norm. There's very few people that shouldn't be wearing a mask, so facial covering. There's going to be some folks because they're too young. So if you're 2 years old and younger, you shouldn't wear a facial covering because we're worried about safety for children, young children. And then there's some individuals that having a facial covering is unsafe because of some medical conditions, but that number, very small. And we know that this is going to be a cultural change, cultural norm. And I thank people for asking about that and asking for clarity in terms of when to wear it and when not. But you describe the conditions spot on. Thank you.
And Madam City Manager, we are soliciting donations of face coverings from Berkeley residents.
We've had an amazing response to donations from Berkeley residents, and I'm really pleased to say it. It's so awesome when we're in an emergency. It's not really awesome, but the fact that our residents respond so readily at the drop of the hat. And before we could even launch our volunteer donation site, people were asking, "How can I? Please let us." And so this is just the most generous community, and we're so grateful. And we've been very, 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 very supported by Berkeley citizens.
Thank you. So the next set of questions are on homelessness, and I'm going to kind of group them together. So First question is, how many people experiencing homelessness have been able to be relocated to hotel rooms or other accommodations? What's specifically being done to address the encampments at the University Interstate 80 interchange? And then the last question is the city making pump out services or other ways for RVs to dump their waste available?
So Mayor, thank you for those questions. So first, let me start with the I-80 corridor. So there's been a lot of work that's happened on the I-80 corridor. Not all of it has been City of Berkeley. The majority of it has been both Caltrans and volunteers. The city has conducted some support services for our outreach folks, and I'll go over what those are. But I just want to give a big thanks to Andrea Henson, who has been out there on the street with our homeless community, cleaning up, bagging up garbage, and working in a very coordinated way with Caltrans. So you're starting to see the cleanup efforts on our corridor, and we're really, really pleased and very happy that Caltrans is taking up the responsibility of keeping their parcels clean and working in coordination with our homeless community. Now, in terms of our unhoused staff and what we're doing here in the city of Berkeley, as you know, we are working with Lifelong. I just have to get my mind around all of the stakeholders that we're working with. Lifelong, we're working with Bay Area Community Services with BACS, as well as with our mental health, our HOT team, and our public health team. And we're going out to all of the encampments, providing food, providing resources, hand sanitizers, water, making sure that people get meals, and we're coordinating with various local community agencies that provide meal services to our unhoused. So we're out there on the street. We're assessing individuals, especially those that may or appear, we're at least asking the questions about how they're feeling, what kinds of symptoms are they experiencing, and we can actually and are testing individuals on the street. So we have the ability to test our unhoused, and we are doing so. And we are placing people into multiple locations. So let me explain a little bit about what those are. We have shelters in Berkeley where we had to thin those shelters under CDC guidelines. So we had to reduce the number of people that were in those shelters so that we could reduce the spread of the virus. But at one point we cleared our Pathways location, and we disinfected, got it ready, and now we've moved people back in. So we have about 10 people that have moved back into our Pathways location. We've placed over 31 individuals in hotels, in the Room Key Hotel in Berkeley, the Safer Ground in Berkeley. As you know, our efforts through Alameda County and others fell through with our local hotel, but we are still trying to find ways to uplift a local hotel here in Berkeley. But now the county is focused on their other two options, and those are the priorities for them at this time. But we'll continue trying to find a location in Berkeley to place people in hotels. Hotels seem to be a better model because people have individual restrooms, individual rooms, and you're not sharing as much space all the time. So as we start thinking about how we're going to look differently in terms of serving and supporting our unhoused, I think hotels and singular type environments are going to be the best way. We have 18 trailers that the city procured, and I believe 10 of those were donated to us through the state of California in coordination with Oakland. And so we've moved some folks into those trailers, and we'll continue moving individuals into the remaining trailers. This is tough work. It's hard. Not everyone is ready or willing to move into closed environments. So we have to also understand that there are going to be people that are going to be on our streets. And we want to make sure that the areas that they're residing in their tents are at least clean, that they're getting served by our support teams, and that we're communicating with them and finding resources for them. So expect to see people in tents. we've just got to get there. We've got to expect to see them intense, but we are also supporting them as well, because we don't have enough hotel space. We don't have enough shelter space, especially after having to thin it. But we are serving them. We are being responsive to them. We are cleaning up and helping them to clean up. We're trying to maintain our sidewalk access so that people still have access on our sidewalks. While our neighborhood services team and others that we normally deploy in these efforts has been reduced somewhat, we are still going out and hitting hot spots and making sure that we're addressing health and safety issues in our city. So again, I want to thank the multiple stakeholders, Caltrans, our homeless activists, our public health, mental health, public works, PD, and all of our teams and our neighborhood services team in my office that are working really hard to get out there and make sure that folks stay safe and test and make sure that we get them into safe places if they test positive. So,
Thank you.
that was a lot.
No, I think it's important for people to know what we're doing to help people experiencing homelessness at this time. And that's a real concern that people have expressed in the Berkeley community. And I really appreciate your commitment to making sure that everyone in our community is safe and is being helped during this time. So just a couple more questions before I go to the health-related questions. These two relate to the library. Will we allow people to pick up tools from the tool lending library soon? And then secondly, when will the libraries be reopened for book pickup?
So Mayor, thank you for those questions. So the tool lending library, that is a high touch, high service area that would require people to use products or tools that others have used. So it's like a sharing environment of tools. At this time, that is not a part of the health officer's order. It is not an essential function, an essential need. So it doesn't meet the threshold for us now, but the health officer and our EOC coordinator are meeting with the library director over the next week and trying to look at what is their plan forward. The library is a city department. While they have a huge amount of autonomy, we still work together. They've been a part of our work since we started. And so they meet with me regularly. The library director does, to go over plans, to address issues. And so the tool lending piece and the opening of the libraries will be timed with all of our phases and looking at how we can get them back online.
Thank you. And then this is a question that either you or Dr. Hernandez, I'm sure, know the answer to. We've heard from some residents that are interested in volunteering to do contact tracing. And I know that we are deploying city staff to do contact tracing, but could there be an opportunity, or will there be an opportunity for residents to volunteer to participate in contact tracing?
So it's likely that there will be an opportunity. Right now, the efforts are being absorbed by, of course, City of Berkeley staff, but we have UC Berkeley public health students that are also supporting the effort right now. So people that may have some quasi training already that can help us and launch things. So we're trying to get the folks that, and also our library staff. So those are some folks that we have kind of pulling into the city to do this resource, to conduct this resource need now. But I do envision that as needs change, as essential functions and public services open up and we need people back in their normal roles, that we may need an uptick and we may need to reach out. So we're working on a resource line. I think it's either going to be a website or a phone line. I'm not sure yet, but we're working on a way for people to actually volunteer to do that job. And Dr. Hernandez, I don't know if you know more about that volunteer effort yet or where we are, so.
The only thing I would add to that is the training that would happen if someone becomes a case investigator or a contact tracer. So we're also working to have a online training so that it's something that can happen if we bring new staff on or volunteers on later in our phases, they're able to take that training online and potentially work remotely. So that's something we're working, actually, some of the staff that you mentioned initially, Madam City Manager, in terms of starting to participate in our response activities, they're taking that training now, and we're hoping to use that same model moving forward.
Excellent. Thank you so much. So I'm now going to move to some health-related questions. And the first couple of questions relate to the existing positive cases in Berkeley. So I'm going to kind of group them together. So this question was very specific around, is there information that be shared around the risk factors of people that have contracted COVID-19? Were they essential workers? Basically, what information, more specific information, can be shared with Berkeley residents on the specific positive tested cases? And then in addition, obviously we've noticed an increase in the number of reported cases in Berkeley. Why is that? And you could, on our dashboard, you can go to cityofberkeley.info/COVID-19. You could see the data dashboard that our city staff have just launched about a week ago. And it has an actual graph that shows the progression of cases, I believe, since March. So, because the first question was about, Dr. Hernandez, was around, is there more specific information on the number of positive cases, risk factors, are they essential workers that could be shared with Berkeley residents? And then secondly, why are we seeing more cases?
So we don't share the demographic information, or like what type of work those individuals do, or if they are working on our data. Alameda County doesn't as well. They do demographic data in terms of age and gender, and they break down by city, of course, as well. And zip code, but we don't. So we don't typically do that. I will say, just in general, what we're seeing is it's those folks that are able to be out. And actually, there was a study in UCSF in the Mission District that was done there for about 3,000 individuals that were tested in just a neighborhood, and pretty much it was the commonality of those that were positive were those that were essential workers that had to go out, that couldn't stay home and shelter in place, or had to go out to, to serve the community or to work. So that's what we're seeing. We're seeing that and their household contacts. But we know that's going to change as we move out of the shelter in place that we currently have to expanding those that are able to be out in the community. So that's generally what we're seeing in terms of why are the numbers spiking or increasing. One is that we're able to test more people. So we have the capability to test, and that's what we're seeing in terms of the cases that we're able to see now. It's people that were not able to be tested beforehand, and also some that are now being exposed because they're out in the community. So it's a combination of the two causing our numbers to rise. And I would say, if I know there's a question later on, so if I could answer it now in terms of like, why can't we test? What are your plans for the test site? My plan is to test everyone if we can. We're not there yet. We have a phased in plan for this test site. We want to serve those that are symptomatic first. There's sort of a number of people that have been waiting for this opportunity. We want to serve those individuals. We'd love to do more. And we're hoping to get there sooner than later.
Excellent. Thank you so much.
Mm-hmm.
These next set of questions are around the shelter in place order.
Mm-hmm.
I'll just acknowledge there was a very specific question around people sort of congregating at Webster and Colby. And I just wanted to call attention to that as an example of some of the concerns I know people have expressed around groups congregating, including in some of our parks. I received a picture, which I have not yet shared with the city manager, but I will, on Facebook chat of groups really clustering in Cedar Rose Park, and that's just one example. And I know that it's difficult for people we've been sheltering in place for about 2 months now, and it's hard. So I know people really want to get out there. They want to kind of get back to some semblance of normalcy, but please understand that this is really important. And this is about protecting you and protecting the people that you care about. So I just want to highlight that, we had a very specific example, but I have certainly seen other examples of people clustering and not having adequate physical distancing. And so I know that that is an ongoing challenge. But to the questions around the shelter in place, since we're not seeing a huge surge of cases as well as numbers of hospitalizations, when will we reopen? I could try to address that, Dr. Hernandez, anything you want to add, which is while the state is moving much more quickly to reopen certain businesses, we're not there yet. We're making decisions based on those 5 indicators that we talked about at the beginning, and making sure at the end of the day that we have the capacity to test, contact trace, case investigate, and to make sure our healthcare system has the ability to treat all the people that may be infected, because we know that when we do loosen those restrictions, we are going to see an increase. There's no question about it. We're going to have to balance that. We're going to have to balance how do we manage that increase with also trying to reintegrate some of our businesses and our economy back into the way it was, albeit that it's not going to be exactly the way it was, because we're still going to have safety protocols for how those businesses operate as well. So I don't know if that addressed the question, Dr. Hernandez. We're not there yet to reopen, but we are, looking at the data, and we are discussing very actively what that would look like and developing a Berkeley specific plan for how we will reopen.
Yes, absolutely. And we don't have a vaccine.
Yeah.
There are trials that are happening for medications, which is great. And some of that is being made available in the United States at specific sites. So that'll help. So that's promising. The vaccine is a ways off. So what we have to do is exactly what you said, is ease into reducing the restrictions that we have, and especially with having the ability to test people and identify when they're contagious and isolate them, because that is what we know is going to be our most effective tool right now, is to make sure people who are sick or contagious are able to be isolated so that we can interrupt disease as soon as possible.
Absolutely. So next couple of questions are on testing. One specific question is, what types of tests are being conducted at the city testing site? And you mentioned it was the swabbing test that's being conducted.
Yes, exactly that. That is the only test in City Berkeley or anywhere that's being used for diagnosis. The antibody or the blood test that's out there is a promising test option, but it is not being used for diagnosis right now. We know that people are getting that test. It can show that you're immune, but we don't really know what that really means and how long someone's going to be immune for. So that information is changing day by day in terms of how much we know about what the blood tests do. But right now, what is being offered in Berkeley and what is being used for diagnosis nationally is the swabbing test, the PCR test, what looks for the virus in the specimen that's collected.
We got a question around what risk is there of an individual to receive a false negative test result and then go back to work or to sort of walk, sort of freely throughout the city. And I'll just note that a test is a point in time result. And it is possible that people that were tested and were negative could be positive in the future, because it depends on whether they contract the virus at some future point. But we had a couple of questions around so the accuracy of tests, and I wonder if you might be able to share a little bit about that issue, Dr. Hernandez.
Sure. And I just want to, before I talk about the accuracy of the test, which is a great question. I do want to say or reemphasize what you mentioned as well, is that this is a point in time, whether you're positive or negative, and that doesn't give you permission to not adhere to the shelter in place recommendations and or the requirement to wear a facial covering. It does not allow you to relax your social distancing activities. Those are still in place because the test, no matter what the false positive, false negative rates are just a point in time. Right then, when you take the test, if you're negative, it's just for that point. Doesn't mean that you're not going to get sick later. It doesn't mean that that you weren't exposed and may need to be may need to continue quarantine if you are contact to a case. So the test that we're using in the Berkeley site has a very low false negative rate. It's I believe less than 1%, and I can get data for next week specifically from the Berkeley lab to give you their performance on those numbers. I don't have a general understanding of all the other labs that are being used there, though I will say that the Berkeley lab's false negative rate is extremely low. False positive rates, same thing, but I'll give those data next week if you'd like.
Thank you, Dr. Hernandez. And the last question I want to pose to you is around supermarket workers. This resident had asked, will the city work with employers of grocery stores to set up a regular testing program for high contact critical workers? Could the city compel those workers to have to get tested? And I know that we did expand the availability of testing at our City of Berkeley test site to other essential workers. And so I don't know if there's anything you want to sort of share about the availability of the city's testing capacity for other essential workers, non-city essential workers.
Right. So anyone who's symptomatic can come and get a test in the City of Berkeley test site if they're either a resident or they work in the city. I think the question is about what we would consider targeted surveillance testing, which is what we're basically doing and what we piloted earlier this week in our skilled nursing facility, looking especially at those populations that are at high risk for getting disease or getting sicker. And both of the population of skilled nursing facility actually meets both of those categories in terms of being high risk. So our hope is to continue that in that type of setting, and if possible, do more expanded surveillance testing. It won't necessarily have to be with the City of Berkeley a test site. That could be something that employers are going to be required to do. We're not there yet, but if you look to San Francisco, I believe the order was released for all skilled nursing facilities to do regular testing. I believe it's every 2 weeks for both the staff as well as the residents. So that is something that may be a reality moving forward, especially in certain sectors. But it won't be something that necessarily is going to happen specifically by the City of Berkeley. It could be happening by other employers if we move that way. But right now we're looking at targeted, especially in the settings of high-risk individuals and high-risk settings like group settings.
Excellent. Thank you very much, Dr. Hernandez. I'm going to address the last set of questions as they kind of address a broad variety of categories. There was a very specific question around ADU permits and whether the City of Berkeley could remove the owner occupancy requirements for putting in ADUs. The requirements of the zoning ordinance are still in effect that do require owner occupancy. And so in order to change that, that would require either state legislation or local legislation to lift those restrictions. And so at the present time, we are not able to do that. But if that is something you would like the city to entertain, I would encourage you to contact your city council member. Question around why large sort of grocery stores, convenience stores like Target are open, but other smaller businesses, specialty stores are closed. It really is around what is classified as an essential business. And some of these grocery stores and convenience stores, also pharmacies, they provide a variety of goods and services that do meet the definition of an essential business. But please know that we know it's difficult for our businesses, which is why, one, we launched the Berkeley Relief Fund. We're going to be moving forward, hopefully soon, to a second round of funding for small businesses through the Berkeley Relief Fund. And that's why it is important that we begin to discuss how to lift some of those restrictions on certain types of businesses that aren't essential businesses, but do so in a very thoughtful way. So please know that we understand the challenges that our small businesses are facing. I'm advocating in my capacity as mayor of Berkeley for increased state and federal resources for our small businesses as well as local governments, to make sure that our businesses can get through this and our local governments can get through this. So please know that I'm doing what I can in my capacity, not only as mayor, but also regionally, in advocating for those resources. Moving to another question, questions around the budget. As we discussed actually at our prior virtual town hall last week, we've begun the process of discussing and developing the fiscal year 2021 budget. We already know that the city is projected to have a $25.5 million deficit, which is a very significant deficit, which is going to have a real impact on city operations. And so our city manager has put forward a very thoughtful proposal to look at what particular positions or programs can be deferred. In addition, the city has instituted a hiring freeze as a way to try to reduce personnel costs, as a way to offset the budgetary impacts. And the council will be engaged working with the administration to look very closely, not just at the deferral proposals, but what are ways that we can achieve cost savings and efficiency in order to keep essential services and public health and safety going, but also to balance the budget. And we know that the economic impact is going to be a reality, not just this next year, but maybe the year after, or the year after that. We are entering a recession. We've seen unprecedented levels of unemployment, and some businesses are still closed and are not able to fully operate, even or partially operate. And some businesses have unfortunately elected to close permanently. And so we know the impact on our tax base is going to be significant. The impact on our pension system, there's going to be increasing requirements for local governments and public agencies to pay pension obligation payments to offset some of the losses. So it's a very challenging time, but please know that we're doing what we can to make thoughtful decisions that are really grounded in our city's priorities of equity and caring for everyone and making sure we're delivering essential services, but also prioritizing health and safety. So please stay tuned for more information on the budget process and how you can be involved. We talked a little bit about homelessness and what the city is doing to address the crisis of homelessness. And if you could please mute.
I'm muted.
Sorry, technical difficulties. We're still learning this. So the city manager talked extensively about what we're doing around homelessness and the fact that because we cannot guarantee shelter for everyone, we have to accept the reality that some people are going to be living on the street. And it is not acceptable. And we are going to do everything we can to get those people off the street, get them into hotels, get them into places where they can safely isolate. But we have to recognize the reality that even before this pandemic, we had a crisis of homelessness, and it's going to be even more acute after this pandemic. So we are moving as quickly as possible to kind of shift our approach, focusing on how to get access to hotel rooms, shelter pods, trailers, expanding shelter capacity to ensure physical distancing. So please know that we are doing what we can to expand access to shelter and healthcare services and social services for people that are living on our street.
And food insecurities.
And food security, absolutely, which is not only an issue for people experiencing homelessness, but for people that have lost their jobs or seen a significant reduction in jobs. That is a really critical issue. And I want to thank the many organizations in Berkeley, the Berkeley Food Network, the Alameda County Food Bank, that are working to provide access to meals and groceries for people who are not able to afford them during this time. And then lastly, the last question was around UC Berkeley. Do we know what the university's decision is about whether they're going to fully allow in-person instruction? What is the impact of that on our city? No question, if UC Berkeley does not have full in-person instruction, it is going to impact our local economy. And that is part of what we're anticipating in the budget projections that we are developing to understand the revenue impacts this next fiscal year. UC Berkeley has yet to make a decision on whether they are going to allow in-person instruction. I have heard that what they're considering is a hybrid model where some courses could be in person, some would be online. I think it's safe to expect that a lot of students are not going to come back, and they're probably going to want to take courses online. That's going to impact our city's housing market as well. So we are in conversation with the university to understand their planning and their decision, and that will certainly inform our analysis of budget impacts as well as just long-term planning the city's engaged in. So UC Berkeley has not yet made a decision. We expect them to make a decision this month, but we do know that if they do not have in-person instruction or even allow partial online or remote instruction, it's going to have an impact. So I'm sure many of you may know, just in closing, you may have seen my hair is substantially shorter than it was last week. That is because I gave myself a haircut. It is not easy. So I recommend that you watch some videos on YouTube like I did. But please know that you do not need, even though barbers are closed, you can give yourself a haircut.
Don't do it. Don't do it.
I think it looks nice.
Yes.
It looks nice.
Yes,
Thank
it
you.
does.
So on that moment of levity, I want to thank our city manager, our public health officer for their amazing service and for once again taking time out of their very busy schedule to make themselves available. Please join us next Saturday for another town hall, and we will provide information to the Berkeley community about how to submit their questions. Please go to my website, jessearreguín.com, for more information on the City of Berkeley's response to COVID-19, and the City of Berkeley's website, cityofberkeley.info/COVID-19, for a comprehensive list of information around shelter-in-place order and other information around the city's efforts on COVID-19. Happy Mother's Day. Thank you, Berkeley, for joining us, and please be safe.
Thank you.
And actually, as we close, we're going to be playing a video on the Berkeley Relief Fund that was actually developed in partnership with our business community. So please watch the video. And if you would like to donate to the Berkeley Relief Fund, please go to Berkeley Relief Fund, all one word, berkeleyrelieffund.org. So thank you very much, Berkeley, and we'll see you next week.